epidemic in this country, and until now, the only tools to fight it have been diet and medicine. But a new therapy can help stop type 2 diabetes and in many cases actually reverse the damage it causes. Here with more, please welcome Dr. Stanley Lewis, the Medical Director of Diabetes Relief. Good morning.
Good morning, Deborah.
I can't tell you how many people I've heard say, well, diabetes runs in my family, so it's genetic. Of course, the CDC says we're more likely to die from family recipes than we are our DNA, right? But yeah, it can run in families, but it's because families are doing the same types of eating patterns and things like that.
Exactly. And, you know, diabetes, one of the things that we do at Diabetes Relief is we try to help patients understand that diabetes is really not a disease. And I know that sounds like a sort of provocative statement because you've been told for so long that diabetes, there's really nothing you can do about it. But the truth is that diabetes is really a symptom of a disease. Way before the pancreas gives up and says, I'm overwhelmed, and waves the white flag, I can't produce enough insulin to take care of everything that you ingest. Way before that, your liver actually starts to give out. And that is the root cause of why most patients develop diabetes.
Yeah,
especially type 2
diabetes is kind of like an umbrella for so many other diseases that are deadly, like heart disease.
Exactly. And so when the metabolism fails, you start to get all of these other symptoms, of which diabetes happens to be one of them.
Yeah. Number one reason for heart disease, number one reason for blindness, renal failure, amputations.
Exactly.
So many different things. So, yes, it would be nice if we say to people, you got to lose weight, and if you lose a certain amount of weight, it could probably make your diabetes go away. Right. However, after you lost weight, oftentimes the damage remains. That's why this is so exciting. I remember when we had some folks come to talk to us about this was in the research phase of being able to actually take a type 2 diabetic patient and reverse their diabetes and reverse the actual problems that they had with it. Okay, so tell us what the result has been.
Well, this has been one of the most difficult things, and it's difficult for a lot of physicians because we find ourselves just really trying to treat the numbers, really trying to just slow down this process that we feel like we're really helpless to reverse. But with Diabetes Relief, we're actually able to reverse some of the effects of diabetes.
Wow.
We're able to, with patients who have developed neuropathy, for instance, we get about a 94% improvement in patients with neuropathy.
That's amazing.
That's unheard of. And we talked about in an earlier segment some patients who are having problems with pain addiction to pain medications. Well, if you've got neuropathy, you'll do anything to sort of get out of that pain.
Right.
And if we can find a way to address the root cause of that pain, then you won't be perhaps at risk of being addicted to some pain medications.
This therapy also, some people who may have been scheduled for amputations, not getting amputations anymore.
You can take them off the amputation list because I've had family members who've had amputations due to the complications of diabetes. You can't feel your toes, you can't feel your feet. You step on something, you get an infection. Next thing you know, you've lost a leg, or you've lost a toe, or you've lost a foot.
It's really like a slow death. Type 2 diabetes
it's like
is like a slow
whittling
death.
away.
All right. So how does this work? It's through an infusion therapy, and what is it doing in our bodies to make a difference?
Yes, we combine an infusion therapy that actually can reactivate the liver so that it more physiologically puts out the 38 hormones and enzymes that are responsible for metabolizing your food every day. And by doing that, your cells actually get re-energized, each cell. So eye cells are re-energized, heart cells are re-energized, liver cells are re-energized, kidney cells are re-energized, and that's why we start to see some of these reversals of some of the bad outcomes with diabetes.
Yeah, I'm like a whole new you.
It's very exciting.
Yeah.
It's got me pretty excited. In fact, some of the patients who came to our center after hearing about Diabetes Relief on Great Day Houston have had some amazing outcomes. We've had, well, every patient that called in, every single one, expressed that they had more energy. But on top of that, and on top of getting their sort of numbers, their hemoglobin A1C in control, they also expressed that they had the ability to walk further. They had less need for medications.
So does this infusion, does it happen several times, or is it a one-time deal, or is it kind of a maintenance program?
We tailor the therapy for each patient. Yes, most of the times you will start out with a couple infusions in the first week, and then after that we may stretch those out over time to where you're coming in once a month or maybe once every
because we know what type 2 diabetes does, like I said, it's kind of like the slow death. Literally what this does is adds years back to your life.
You could say that.
All right. Well, you can get a 3-month supply of metabolism enhancer when you make an appointment with Diabetes Relief by the end of this week. Call 281-600-5000, 281-600-5000, and be sure to mention Great Day Houston when you call. And for more information, log on to diabetesrelief.com. This is like cutting-edge medicine right here. Amazing. All right. Well, one of the leading causes of type 2 diabetes, as we mentioned, is excess weight. But losing that weight is hard. Up next, a customized plan designed just for you that can finally get you the body you want and, more importantly, improve your health.